Hello, my name is Dr. Roland Männchen. I am an orthodontic specialist, the president of the Swiss Orthodontic Board Examination Committee, a member of the Angle Society of Europe, and I run a private orthodontic office in Winterthur, Switzerland. In the next 10 minutes, I will give you a lecture on the interdisciplinary ortho-surgical treatment approach from the orthodontist's perspective. But this has also a major impact on the success and stability of the maxillofacial surgeon's treatment. The aims of this presentation are that you will be ready to identify indications for surgery, recognize how to take an interdisciplinary approach, and describe the orthodontist's role in pre-coordination. You should all be familiar with this illustration from Bill Prophet's famous textbook, in which he describes the maximum envelope of occlusion change which can be achieved through orthodontic camouflage in adult patients, which is the black curve, the limits of correction in growing patients by orthodontic tooth movement and orthopedic correction depicted by the inner red curve, and the possibilities of orthognathic surgery combined with orthodontics represented by the outer red curve. I have many reservations to this illustration. My experience does, for example, not support the fact that more extrusion than intrusion of upper incisors can be performed. And you as maxillofacial surgeons surely do not want to set back the mandible by 2.5 centimeters for fear of sleep apnea and the risk of producing double chins. So this illustration is at least very questionable. The limits are very individual for each and every patient. Applying orthodontic forces in a growing individual means that we are confronted with two effects: the changes due to growth and development, and the biologic response to the orthodontic force, which add up to the result. If we, for example, apply a headgear to the upper molars, we may see as a result an extrusion of the molars, although the direction of orthodontic force was horizontal. Since we only know the direction of force, but not the amount of biologic response, or the effect of growth and development, we can never exactly predict the result. We therefore have to constantly analyze the progress of treatment and adapt the mechanics accordingly in order to reach the goal. And we may have to ask ourselves repeatedly during the treatment, do I really manage to achieve the goal? If I really do manage depends on 4 factors: the type of malocclusion, the degree of the discrepancy, the amount and direction of growth, and the patient's compliance. Concerning the type of malocclusion, this quite old illustration by Sassoon is very helpful. It depicts in red the sagittal and in blue the vertical deviations. And there are 4 possible combinations of the two in the 4 corners. There are 2 good and 2 bad corners. Good is the combination of class 2 and hyperdivergency. If you are able to control the vertical growth, the mandible will perform an anterior autorotation, which also corrects the class 2 and the hyperdivergency at the same time.